Hello, everyone, and welcome to our session today. If you are new here, we are so excited that you're joining us. We appreciate every one of you listeners out there, and we really sincerely appreciate your ongoing support with Zessions. My name is Mandy Rourke, and I am a licensed marriage and family therapist in Austin, Texas. I am also one of the co-founders of Zessio.
And I'm Dr. Sapna Srivastav, also fellow co-founder of Zessio, which is a mental health platform for resources created by clinicians. And sessions are conversations amongst clinicians. We talk about topics typically addressed in the mental health world so that there's the perspective of clinicians who support clients daily and have these conversations on a regular basis.
Yes, and today we are so excited about this topic. Our topic is skin-focused repetitive behaviors with Stacy Nakell. Welcome, Stacy. Thank you so much for being with us today. Tell us a little bit about yourself.
Thank you, Mandy and Sapna. So I am a licensed clinical social worker, and I've been practicing since 2002. I'm a certified group psychotherapist and a certified clinical trauma professional. And I've been focusing in on working with skin-focused repetitive behaviors for most of my career. And so that's really been my passion, and particularly applying a psychodynamic, an integrative psychodynamic perspective to this population that's normally been treated through with cognitive behavioral therapy. Um, and so I'm happy to be here and share a little bit more about what I've discovered about why this is such a good way to work with skin-focused behaviors.
Yes, we're so excited to hear more and be able to share more about this topic. We've already loved talking to you about this so far in our conversations leading up to this. But before we really dive in, I wanted to go over a few housekeeping things. If you enjoy our content, if you enjoy our podcasts, please consider liking, following, and or giving a positive review or rating on any and all podcast platforms that you utilize. These ratings and reviews help more people who could benefit from our content find it. And so additionally, you can also follow us on Instagram, TikTok, or YouTube at MyZessio. That is our handle at MyZessio. That's MyZessio. You can also find us at zessio.com. That's Zessio.com.
Beautiful. All right. Well, are y'all ready to dive on in?
Let's
Ready
go.
for it.
Let's do it. So as in our typical fashion, when we do sessions, we always like to start off these conversations by getting really clear about what it is that we are talking about. There's so much that can be lost in translation around the words that we use. And so when we say skin-focused repetitive behaviors, what does this mean?
Yeah, that's a great place to start. So, these are behaviors that are typically known as body-focused repetitive behaviors, and BFRBs has been the way they've been referred to for decades now. What I noticed when I really delved into the research is that I was intrigued by the fact that hair, skin, and nails all fall under the category of dermis. And so we're talking about behaviors that involve the hair, skin and nails. And so I think skin focused repetitive behaviors is really an interesting way to think about them. And one thing that gives us, I wanted to understand what do all these things have in common. And they're all the cells of our bodies that grow, and they slough off, or we have to in some way groom our hair, our skin, and our nails in particular. And so uh, when you think about that, it makes sense that repetitive behaviors that involve the skin are over grooming behaviors that have a particular function. And in this case, the function is to provide some both emotional and physiological regulation. So they're really a coping mechanism for calming the central nervous system through all kinds of stressors.
Yeah. So you started to mention kind of over grooming, but what does it typically look like or feel like even to engage in skin-focused repetitive behaviors, or SFRBs, for short? Like, how does someone know that, like, oh, that's something that I'm doing that's considered an SFRB?
Yeah, so there are many names for all of these experiences. So trichotillomania is hair pulling, and dermatillomania is one way to refer to skin picking, and then onchophagia is nail biting or cuticle biting. And each of them has a number of sensory components. So people will usually engage in some sort of pre-behavior, looking for some kind of if it's hair, maybe a different hair, maybe a kinky hair in particular, or on the face or the body, looking for a bump or a pimple or something, a scab, something that is rough and not smooth. And so that can happen really unconsciously, sort of with feeling, or it can happen consciously as someone's looking in the mirror. And so after that, sort of feeling out and finding that um, imperfection of some kind, then there's the either pulling out of the hair or the picking and squeezing of pimples, or um, whatever that element of it is that happens during. And then there's usually other senses that come into the after. So sometimes people enjoy playing with the hair, or taking, if they get the little bulb out, rubbing it on their mouth or crunching it between their teeth. And with skin picking, there's the very similar, looking at a scab, smelling even scabs or sebum, and maybe playing with it in between the fingers. So these sensory components are actually part of why people feel very ashamed of their behaviors, because we don't usually talk about things like eating hair, and it has a component of disgust for both the person engaging in it and then maybe the therapist that they go talk to about it. And so right now, in naming those things in a matter of fact voice, that's one way that I work with my clients as well, to just accept that this is part of the behaviors, and it's not something gross or so weird. It's more just um, related to our animal natures, and that we have all these sensory relationships with our body and with our skin. And whether you engage in this in a problematic way or not, everybody knows the pleasure of maybe plucking a hair or squeezing a pimple. And so it's really important to first shake off the shame around those behaviors. And they do have this component of calming throughout that whole process. There's something about the whole ritual that provides the calming or the soothing that person may need.
I like the way that you were explaining this as this is animalistic, and maybe a lot of humans, or maybe not a lot of, I mean, just depends, forget that we are animals. I mean, I think that we know that, but also, we're like the more intellectual animals or something. But at the core of our being, we are animals, and we find ways to soothe, like you're describing, with like distress within the nervous system. And it made me think about this morning. I'm just sitting there reading my book, and my puppy's just there licking the legs. And I was like, that's in essence just a very simple animal way of soothing or grooming. And, as I say that, it's like I don't look at my puppy and be like, ew, gross. Why are you licking your fur? I'm like, oh, sweet puppy is calm and is relaxed. And you could sense that. And so I do appreciate you also sharing that a big element, it sounds like, that you help your clients with is helping shake off the shame within that. And part of that is being able to say, like, we're animals finding ways to help ourselves. And this is one way. And I think, kind of in that same train of thought, and maybe I'm sort of answering this in my mind as I'm asking it, but why would people develop these types of maybe more repetitive? Because I think as I'm asking that, I'm curious of, like, there's almost like essential grooming or like
Mhm.
necessities. But then what we're talking about today, is it like in more of like a excessive way of coping, or how would you describe all of that? I'm asking a lot.
Yes, no, but you're bringing in one of my favorite kind of ways to think about these behaviors, which is that animals do engage in over-grooming behaviors as well. So it sounds like what you're describing with your dog is just regular grooming, which we do too. We're always sort of touching or feeling or playing with our hair, or that's just part of just our animal nature, along with then we have this human element where we're looking to change our appearance in ways that we find more attractive. But animals also engage in over grooming behaviors, but only under certain conditions. So they don't do it in the wild. Um, and so they do it when they enter our worlds. They do it when they're animals who are pets or lab animals or zoo animals or on a farm. And so that really can be another way that I use to explain to my clients how we can start to think about this in a way that doesn't make you a problem. Because when we think about animals who are engaging in these behaviors, really it's their environment that's problematic. And so actually vets have gone in and done some studying about what those things are that lead to those kinds of behaviors. And they've discovered that, let's say horses engage in a number of body focused behaviors. One of them is called cribbing, where they take in a gulp of air and it does release endorphins and calm them. But that only happens when there's a condition that makes them feel less calm. So they've discovered that those four conditions are isolation, boredom, frustration, or being trapped in too small of a space. And if they change the conditions of that horse, there can be a reduction or even an elimination of the behavior. So that's one way we kind of can look at it and say, wait, it's not the horse's fault that that horse is bored. It's really that it's a horse is supposed to be out grazing. And if food is just given to the horse with feed, of course, that creates boredom. And the horse is just expressing that boredom. And then if the owner listens and takes the horse out to graze, for example, that can relieve the boredom such that the behavior is no longer important. And if you think about those four triggers, they're the same triggers for humans: isolation, boredom, frustration, and being trapped in too small of a space. So I think this really gives people a way to see, oh, this is not me. I'm not somebody who does this and I'm a freak. My body is expressing some discontent with my environment that I now have the opportunity to listen to. And if maybe there's a child who's starting to pull their hair, this can be a message to the whole family that there's something in the environment that maybe isn't working for lots of the members, but this is the person who's first expressing it. Because it is very distressing. Hair pulling, skin picking, nail biting, all of them have side effects that can be very detrimental: social side effects, medical side effects. When you have a bald spot or you have open wounds, it affects how you feel about yourself and how others feel towards you. And isolation can really be both a contributor and a result of these behaviors.
Yeah. I appreciate you describing it that way too, of kind of sharing it in the context of kind of animalistic instincts, but also in response to the environment and again, coping specifically with that environment and humans doing the same thing. I was about to ask you before you dove into that answer of like, you talked about shaking off the shame, like what are the ways that you tend to frame that with clients? And it sounds like this exact way of like, let's look at your environment and how you're coping specifically with these four factors of you said isolation, boredom, frustration, and being trapped in a space that's too small or uncomfortable, it sounds like. And so yeah, I'm not sure if there's any other ways that you really kind of help clients shake off the shame. And then in addition, you talked about, I'm going to throw multiple at you, sorry. You talked about um, things starting to feel more detrimental socially and physically, and kind of that like vicious cycle that happens of like isolation being a cause, but then also like an outcome that can happen as these behaviors are engaged in. And so also trying to understand more like, how do we know when these repetitive behaviors become harmful or when when help is needed externally.
Yeah. Okay. So let me see. I think I can keep up with those questions, but we'll see. Um, so yes, another way that of shaking off shame is actually talking to people about that cycle itself. So one one thing that happens is when people see the results of their behavior. So let's say somebody is pulling out eyelashes and they pull out a lot of lashes on one eye, and then they look and they say, "Oh my God, I look terrible. Oh my God, I've look what I've done to myself." The next thing they're going to do is start pulling out the lashes on the other eye. Whereas if we can say, let's interrupt that cycle and let's just sit with, okay, I did this. I'm not going to feel ashamed about it. I'm going to ask myself maybe a different question than what's wrong with me, or how could I have done this? And maybe I'll ask myself, wait, what is my body saying that I need? And if we can start to ask ourselves that question, that's a question that comes from self-compassion, which is the antidote to shame. And so I really encourage people, even if they hate their body focused behavior, which they often do, and they come in just saying, I need to get rid of it, like help me get rid of this awful behavior, then I'll often just say, I wish I could. But behaviors don't actually respond well to our hate, because they're communicating something. And so if you actually really want to let go of this behavior, funny enough, you're going to have to try to respect it first and maybe even befriend it. And then we have a different conversation. Um, so that's another important piece. And then you asked about, yeah, how do we know this is a problem? Well, there are people who, especially things like nail biting, I think people can nail bite in ways that don't interfere in their lives. And maybe it's a little bit annoying to their partner, or maybe sometimes they don't like the way their nails look, but no problem. Or people can pull a hair or two, like all of us maybe pull some gray hairs, or pick a pimple. But it's really the distress that it causes that leads it to become like clinical, diagnosable. Some of the criteria are that it interferes in at least one category of social or occupational or relational functioning. And so really it's kind of up to the person who's experiencing it to say, oh, it's bringing a level of distress that is outweighing sort of the usefulness in my life. And that's how we know it's a problem. They may try to stop, but not be able to. And that's another criteria for the diagnosis. So people come to me when it's come to a level where it's really interfering in their lives. And
Mhm.
they want better. They want some other ways to cope that are not so devastating.
Mhm.
And usually people can't just do that by themselves.
Well, and on that note, I am curious of if there's an overlap with other types of diagnosis or diagnoses like obsessive compulsive, because I know that is something where it's like there's this fixation, or like even as you're describing the eyelash example, it's like if I remove one set and then it's almost like it feels like it's a compulsion. It could turn into like this compulsion of like that soothing. And so then the idea of like, don't do this other side, don't do this other side, but that's something that my mind kind of locks in as like, this is what I do, whether I'm thinking about that consciously or not, it becomes maybe that fixation. And so all that to say, I am curious of like overlap with diagnoses with people that you work with or your clients.
Yeah, and that's another really important question that kind of gets to the heart of things. Diagnostically, hair pulling was in the category of impulse control disorders up until DSM-5, and that's when skin picking, or they call it excoriation disorder, made it into the same category, and they both moved under obsessive compulsive and related disorders. So I think part of what's been hard to categorize is that they do have impulsive and compulsive features. And there has also been some discussion about creating a category for these behaviors in the DSM, so that because they do have more in common with one another than with any other um, category. So the important thing to note is that about 70% of people who describe clinical levels of these SFRBs have comorbid diagnoses. So also are struggling with other diagnoses. And this is very informative, I think, for me in understanding how incredibly useful they are in regulating our emotions because they can regulate in so many different directions. So one of the most common um, diagnoses that goes along with this is anxiety. And then another one is depression. So if I'm anxious, I can both use my hair pulling to regulate my emotions down, but if I'm depressed, I can use my hair pulling to stimulate me and kind of bring me out of something. And similarly, ADHD is a really common diagnosis. And a lot of people describe kind of focusing in on the computer as they're pulling their hair or picking their skin. But PTSD is another really common diagnosis. And people describe doing the same behavior, but it becomes more of an escape, more of a trance-like state. And so there are different kinds of states that can be induced by these behaviors, and we can see how many different ways they can draw us closer to homeostasis. So a lot of my clients get really frustrated when they realize that excitement is something that can make them pick or pull. And yeah, excitement lifts us up, and we've got to think about what the pulling is doing in that case. So in that case, we're looking for some down regulation. And so if you're excited and you want to not pick or pull, you need to find another way to regulate yourself down. So I think, did that answer the question? Okay.
It does. And I also just want to point out how helpful it is that you're describing it as how, like we're learning how useful these are. Again, I'm thinking about combating shame and just how heavy shame can feel. And so I can already just picture myself as a client of yours and hearing the type of conversation you're having around that to just really destigmatize that for the client of like, let's understand like these are helping you truly cope with the discomfort of your experience. And so to be able to see it as something like, how can we like affirm its use and or function as you're describing it, but then also I think from a clinical standpoint, how can maybe I'm jumping ahead a little bit of like, how do you then support clients to have it so that it doesn't turn into like the coping turns into something that you have to cope from type of situation.
Yes, right. That's a good way to put it. Yeah. Yeah.
Yeah, I was also curious, as you were just saying that too, of like, what are some examples of how, I mean, if you can think of any that you kind of reintroduce different ways of coping. So in that example of when things are exciting and you're trying to down regulate and kind of calm yourself down a little bit more instead of poking or pulling, what are ways that you kind of help clients to redirect ways to regulate? Just for example, to give us an idea.
Sure, sure. So, I think one way that that kind of might be it's a little bit intuitive, is that a lot of times clients who tend to pick and pull or bite really do have a sensitivity to animals and really strong relationships with animals. So being able to pet a dog or a cat is really one of those things that can also regulate you from all different sides. And so a lot of my clients, that's really what they like. They'll think, okay, wait, I need a little bit of that pet therapy. And then they can it basically just takes you being able to notice and pause and notice that your hand is going up there or your nail is going to your mouth and then you can say, okay, is there another way I can meet this need? Petting an animal is a really good one, but also asking for a hug or realizing you need to talk about something. And, if you think about all the emotions sort of come from and might get stuck in the body, how can we get them out of the body? So anything that does that can meet that need. It could be even going for a run and just expelling some of that nervous energy that comes with excitement. And then you just might not have the restlessness all in your hands.
Yeah.
And it is funny. I have I have online groups and we have so many cats going by the screen and so many rubbing of cats. It's pretty amazing.
I love that. I love that a lot. That alone would actually probably help me regulate, but I would also be very distracted by all the cute animals. But I also loved how you were describing that as like expelling that energy and like noticing that that's something that is inside you. You maybe have some kind of emotion that you're not able to kind of channel a way to expel that energy, and that's usually when maybe picking or pulling or biting kind of comes in. And so what's another way to kind of expel that? And then I thank you for those examples. Those are helpful and I think will be helpful to the people listening too, of just multiple ways of figuring out how you can kind of expel that energy and kind of meet your body's needs in that moment.
Yeah, exactly.
Yeah, I like that. I'm also curious if there are any patterns that you've noticed in your work or in research of onset of SFRBs. Is it usually something that kind of starts in childhood or really is situationally based, either kind of across ages or more so in adulthood? Like, what have you noticed or understood?
Yeah, well, actually there is a typical time. The most typical time is during adolescence. And I'll just say that is definitely not always the case. People can develop these behaviors as young as like 2 years old. So that there are 2 year olds who have been pulling and eating their hair in a way that they get the medical consequence of a trichomozoar, which is like a digestive issue that then needs surgery. So that's the saddest one, like a 2 year old struggling with like bald spots and then these stomach issues. I don't work with kids that young. And partly I think because that just breaks my heart. So I work, we all have to work with the populations that we're better suited to. And so, but also people can start at any age. Um, Definitely people can start later in life. But I think what I why adolescence is such a typical time for this onset, I think it comes down to a few things. First of all, I think hormones are always part of the picture. And people do in their adult years describe that their picking or pulling or biting goes along with their cycle. So premenstrual will definitely lead to more restlessness in the hands and more engagement in the behaviors. And so you think of adolescents who are already, have all these hormones coursing through them. And then usually the precipitating factor at that time has something to do with the relationships in the person's life. So the most common precipitating factor, both in the literature and in my experience, is a divorce. And if you think about it, that really makes sense as a time when somebody might need to pick up a new coping mechanism, because here's this household that maybe feels secure, and then of course, a divorce leads to a lack of security, some losses, and oftentimes not a lot of talking, not a lot of asking how the child feels, or how the child sort of has to go along with and maybe even tend to the parents who are struggling. So that is a really big factor. But other relational elements can include like the loss of a beloved grandparent. And maybe the family is not knowing how to grieve that well. And so maybe it's just going through the motions of the funeral, but nobody again is asking, how do you really feel? And even making room for that bodily release that goes along with grief, like being able to cry. So oftentimes when we pick up grief later on in life and in sessions, the crying, the release, the letting go is part of what needed to come out of the body that kind of got stuck and then released bit by bit in the behavior. So the other piece that is interesting, and there is clearly some genetic connection, they're looking into what the genetic element might be, but there does tend to be sort of this greater than average intelligence and difficulty in one subject, often math. So just very interesting to see how common that is. And I went and led one of the Austin support group. I came and just led one of their, it's normally a leaderless group, but I led one just to provide them a little bit more of that therapeutic holding space. And I asked, when did people first remember their first hair pulled, or in particular hair pulled? Uh, Many people said in a math class. And it
Hmm.
was usually a math class with a mean teacher. And so what I've just come to understand from that is that there's also a perfectionism that goes along with these behaviors, and sort of an overachievement and a focus on external accomplishment. And then if people have a hard time in a math class, it kind of challenges that. Maybe for the first time, they're not getting an A. And then that can become a self-attack. So those are the two real common elements that I hear over and over as when it comes out in force.
Hmm. That is so interesting. I think it's helpful to hear, and I think for clients to think about what is my origin story here and really to get curious about that. Like, I wonder what was going on with me in that math class and what was I experienced to just really illuminate things that maybe they've not considered about, like the perfectionism that you're describing, or just um, yeah, I think that's a helpful starting point of like if we can understand where it originated and then we can begin to understand what those potential triggers are to in the current access that as a way of soothing. And I think, we're already kind of touching on this too, but it feels important to ask as well. I mean, do you think that, and maybe as you're listing off, divorce and loss, I mean, those can be some traumatic incidents that adolescents or, adults experience. And I am curious too of if you've seen, and maybe it's an adolescence or maybe it's an adulthood, but a connection with these types of behaviors with trauma specifically, like a one-time thing, or I don't know. I'm curious of what you've experienced or what you've read.
Yeah, so this is actually a real stress point in the community, and part of why I was so compelled to write my book, because the CBT community has really separated trauma from body focused behaviors, even though they acknowledge that some of these attachment stressors are the cause or the precipitating factor, and also that PTSD is one of those common uh, comorbid conditions. So it was really important to me to bring it all together, because there is a lot of research that does show that there is a connection, that a traumatic incident oftentimes is that precipitating factor. And sometimes that traumatic incident can be involved, can be something about the divorce, um,
Mhm.
or some kind of traumatic loss, but it can also be some of the things we think of more commonly, like rape or domestic violence. Those can definitely be precipitating factors. Anything that we have to cope with uh, is usually like, and from trauma informed perspective, we're supposed to never discount the possibility that a traumatic experience might be influencing the behavioral issue.
Mhm.
So I think that's a really important piece. And I think it's really invalidating to say that trauma is not related, because then all the people who have that connection feel invalidated. Uh, and so I think it's really important to also acknowledge that that's not always in the picture. And I think therapists may have assumed it was in the picture at one point and then kind of went the other direction, but definitely can be one of the things that people are coping with.
Mhm. I mean, it makes sense to me from being informed with trauma, especially when I'm looking at those triggers again of like how isolating it is after those experiences and the frustration, like the entrapment within that. Just 3 out of the 4 there. It's like check, 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 all of those tend to
Exactly.
be experienced, which is again, it goes back to it's amazing how as humans, you figure out ways to cope. And at the same time, like some of those copings can be very helpful. But I think it's kind of tricky though, too, of like this thing is helping me, but it's hurting me. So how do I Like, how would
Yeah.
you have a conversation with someone if they said, I want to stop doing this? Like, I know it helps me, but I don't want to do this anymore.
Yes, and you're reminding me of one of my favorite metaphors that a client introduced, and she engaged in picking and pulling, and she called it her blanket with thorns, which I just love, and I do use that sometimes in sessions because, and also in trainings because what therapist would take away a blanket? Um, just because it has thorns, we're going to have to take it as a whole, right? Um, and so I think, yeah, really thinking about it as in all of these complexities, um, is the way that I talk to clients, and I'm really honest, about I'm not going to fix this for you. I'm going to be frustrating for you. It's going to be longer than you want. Sometimes when we start, it might get worse, and you'll be mad at me, and guess what? If anger turned inwards is kind of, and that frustration turned inwards is one of the ways that that this is triggered. If we can find a way for you to express your frustration toward me in session, we're also going to be able to find more of that assertiveness and emotional expression that's going to be one of those ways out. But it's going to be it's going to be a long and complicated process. And I can't just, it's not going to go away because if I had a magic wand, sometimes I'll say that if I had a magic wand, I would use it. If there was a medication that had been shown to relieve that impulse, I would tell you. It just hasn't been. It's a little more like, like you, you will grow in all of these other important ways in our work together that even if you came to me just to stop pulling. So we can see it different ways. In some ways that we're working on actually improving your quality of life and clearing out things that have been getting in your way. And that's maybe more exciting than just the idea that will help you reduce your reliance on these behaviors.
Mhm.
Yeah, I like that. It's not just focusing on this one symptom, kind of going back to it's a manifestation of the environment that you're in, right? And like kind of the stressors that you're dealing with. And so just focusing on this one symptom is probably not going to be what ultimately helps you cope in different ways. Let's focus on the whole picture and kind of improve that quality of life so that we give you different tools, and you can cope in ways that are less distressing and have less effects of physical and mental and physiological impact. It sounds like, which is kind of going into a little bit of the next question that I was going to ask you. Might have just answered it, so feel free to be like, "Oh yeah, we covered that,"
Okay.
or add anything in. But what does that support and treatment typically look like? Like what I mean, I know you said it typically will take longer than people think. We're not going to focus directly on this. It may get worse before it gets better. But what does it typically look like to go through treatment for this? And how long does that on average tend to take if there's even a ballpark we could put towards it? It may not be.
Sure, sure. So I guess one thing that came to me in your last question is that maybe a good way to explain it too is it's pretty similar to eating disorder treatment. Just some different, very specific elements that are important to know, but we definitely don't think of the eating disorder as the problem, right? It's the symptom of the problem, and we have to go down and deal with all those internal and maybe external relational dynamics, to get somewhere. So maybe that gives people a context.
Mhm.
Uh, so what therapy looks like is, I a lot of what we've been talking about is what I think about as the safety phase, where we're really working first and foremost on releasing the shame and bringing in the self-compassion, because there's really no behavioral change that can happen until we do that. So we're also building the relationship. It's really that that psychodynamic process where we are forming the therapeutic alliance in that first part where we're agreeing on goals and tasks and building up some trust. And that agreement on goals is part of what we were just talking about, like going back and forth, like people aren't happy with what I'm saying. And then, we have to come to, well, if you want to work with me, like this is what it's going to look like. Is that what you want? And so sometimes that's not what people want. They want a behavioral approach and they go that direction. But if they work with me, once we get past that safety phase, which is not like a concrete moment where I'm like, okay, we're done with this phase. But it's really more that there's trust in the room. There's one of the things I work very deeply with is the body. So my body and their bodies. And so the first thing we have to do in that safety phase usually is work on being aware of the breath and being able to breathe more deeply, because all of our feelings are all packed in the body, but the breath is what brings us in. And a lot of times people breathe more shallowly because they don't want to feel all that muck. And so that's part of our negotiation is, okay, I'm going to ask you to feel some muck. And when we're ready and we can breathe and we can start to just have a little bit more of a relationship going on, then it's kind of like, then we sort of have a sense that it's time and we go into more of these yeah, like you were talking about, Mandy, like I like the origin story framework that you put in there. So we have to talk about the origin story, and then that will lead us to what's been unresolved. And I think about it as um, what can we what can we take out of the kind of packed in trauma, whatever experiences haven't gotten digested, how can we take them out and begin to digest them? And so in that process, I think of it as embodied narrative therapy, where people are telling their story, but connecting back with the emotions and the sensations. And then I'm also embodied, and I might be feeling some of the feelings that they're not ready to feel. I might feel a lump in my throat and know that something needs to be said. And maybe I'm the one who needs to see if it's this, like, well, what if you were to say, if it's in my throat, and maybe this is part of you've let someone cross into your boundary, and I'm starting to feel like I need to say back up. And then who might they need to say back up to? So then it kind of goes into um, you're also working in your life to create more space for yourself so that you have more emotional expression and you're being more assertive. And then there's less frustration getting built up. And I also tell people, this is the other thing, and you guys know this from therapy, is that sometimes the system is really comfortable as is with the person as is, except like, just get rid of this thing, stop pulling your hair. But a lot of people don't realize if they stop pulling their hair, it also means they might be expressing more what they really think and mean and being less sort of perfect and accommodating and pleasing. And then we have to deal with all of those changes in the family unit or whatever the relationship or whatever it may be. And then that begins to be part of what we talk about. So I think of it as really an ongoing journey that we can always touch base and say, well, how was your picking or pulling this week? And if it was really intense, it's just another sign that, okay, what did we stir up and what's getting hard? Um, and then if it's getting better, then we sort of know we're on the right track. So I think of it as it's so much just like psychodynamic therapy, except we're using this, we're really focusing in on the body, but we're also using this information of the symptom as a way to log what's happening um, and how we're doing in our work.
There's so many layers to this, truly. And I think that it really just opens up the need to acknowledge that if this is something that you or someone that you know struggles with, that, they have people like you that they can go to and really unpack all of this. And I think that the recurring theme in my mind is that it's like how to get this out versus like it all just compounding and getting stuck within, where then it's like it just, your body's going to find some way to get rid of that. Like, the emotions haven't run their course yet. And that's like one way for it to do that. But I think just and everything that you were just describing, it feels so comforting, I think, to know that that people can, they don't have to go at this alone, you know, and that I really appreciate just how honest you are with clients too, of like, you might not like me at certain moments, or you might be, maybe not that, but you might be frustrated with me in our process because I'm encouraging this growth of more of that expression and changing essentially the way that you navigate things in life or how you function day to day, which does we have a couple other questions that kind of overlap here, but um, it sounds like you do talk a lot or help a lot around the areas of like how do you show up differently maybe for yourself, for others, which I think can kind of blend into like how might your lifestyle shift by way of our work together or acknowledging that this is something that hasn't been helping you in the ways that you want. And so I'm kind of going all over the place here, but I think the key question is like how do you help people really find some courage to change their lifestyle or how they approach these situations?
Yeah, yeah. Well, I think I think there's yeah, and I was remembering I forgot to answer the question about how long it will take, so I'll kind of go back to that. And I would say at least 6 months to a year before really we get anywhere. I have I think of goals in terms of moderation and reducing your reliance on body focused behaviors and maybe increasing other coping skills. So I'd say if when we look at it like that, a year or two is a realistic expectation. Um, Sort of the longer you've relied on on your skin focused behavior, the longer it'll take to let go of, and also the more trauma in the mix. Actually, usually the symptoms are much more intense, and then we also know that it might take longer to build some of these skills. But yeah, I like to think of it in terms of just coping mechanisms. We all have to have coping mechanisms, and we can think of them as there are really immature coping mechanisms, and then there are more mature coping mechanisms. So body focused behavior, because it's sort of um, just an acting out of feelings rather than a awareness and expression of feelings, we can put it in the category of a less mature behavior, along with like suppressing your feelings or projecting your feelings on someone else. And so if we're going to think about not only reducing your reliance on the behaviors, but increasing other healthier coping skills, what are those coping skills? Well, some of the more mature coping skills are emotional expression, emotional modulation, which means I have a choice of how to respond, even if I'm emotionally activated. And then sublimation, which I think is the one you're really picking up on, Mandy, which is like, how can I transfer this aggression into something productive? So what might that be? So for me, that's a lot of different things. That can be writing, that can be um, boxing. I really like the literal like getting it out through on a punching bag, or or just asserting yourself. That is another way to sort of turn this like this internal sense that something's wrong. If I assert myself, I can sort of claim my space, and that's a much healthier coping mechanism as well. But there are so many steps to get there, because we first need to know what we're feeling, why we're afraid to express ourselves, how the person that we're expressing ourselves to might react, and how to react to that. So all of that is also something that I think group therapy can be really helpful part of, because um, even if you can't really practice with some, like maybe your spouse is not open to your new emotional expression, but you're in a group and you can still get a chance to try on how it feels to say more, hey, I didn't like that, or hey, I need talking time. And then see if that reduces that feeling in your body, and getting a sense of, like, I think of it as like your stress cup gets really full, your urges are going to come, and you're going to have to pull or pick. But if what does it take to reduce the stresses in your cup? so that the urges aren't so high, so you have a choice. And that cup looks different for everybody. But I think that cup is also another way of introducing self-compassion. Because when we think of our internal stress cup, it's a way of thinking about what do I need and what am I missing and what's too much.
Ah, deep breaths. Great. I love it.
I know. I love the way that you frame things. And honestly, I think even for those who may not be dealing with SFRBs specifically or in a distressing way, just I think hearing kind of the reframe of how we're thinking of our behaviors and the outlets for letting through emotions and kind of dealing with that process, I think is there's so many gems here in so many different ways. So I so appreciate it. We both do. I'll speak for Manny too, because I know she feels the same way.
Yeah.
Um, but I also want to ask, kind of as we're wrapping up here, are there any other things that we didn't touch on that we wanted to make sure to highlight and or just reinforce as something that we definitely want the audience to make sure they take away?
Yeah, something that I didn't highlight, I guess, is that even if it doesn't reach to the level of a diagnosis or it's problematic, um, both for therapists to think about when usually it'll be playing with cuticles
Mhm.
that people will do in sessions and that therapists sort of either don't notice or don't feel comfortable um, kind of using that information. So I really encourage people just to use their own behaviors and the behaviors of their clients as information. And that one way to do that without shaming is to again use that first session as a way to set up the expectations. So I'll say that too. Like I'm really into body language. I'm going to be noticing all these things that we don't normally like say aloud. And you're welcome to tell me if you don't want me to. You can say like, okay, like maybe I'm asking what is your foot saying because it's jiggling, and you can say like, I don't know, and I don't want to know today. Like, leave my foot alone. Uh, so that's just something that every therapist can use and every person can use in terms of trying to be curious about these behaviors versus disgusted by them or sort of sensitively not mentioning them.
I appreciate you bringing that up. I caught myself the other day in a high intense couple conflict session, and I was like messing with my cuticle, and I was like bringing in my Stacy. I was like, what's going on? Take a deep breath. Okay, you're feeling a lot right now, and I noticed. So I think it's helpful for everybody, whether it's a therapist identifying it with their clients, within themselves, you as a person, just being like, wow, I'm like really noticing myself, like kind of going into that pulling or picking or biting behavior, and what else might be going on. And I love, I mean, my favorite thing in the world is just approaching that with curiosity and compassion is essentially the way to work through it. Stacy, before we wrap up, you are also working on an amazing course. I know that Sepna and I were privy to be able to check out, but can you share a little bit about the course that you are going to be offering here in the near future?
So I am excited to be part of this project, and I really liked the idea of providing a little bit of insight and compassion for people who maybe aren't able to afford therapy or honestly, I'm training therapists around the country and have been for the past year, but there are not very many therapists who practice from a psychodynamic standpoint. And so if you can't find somebody who is interested in sort of looking at where this comes from and the full picture, and you just uh, want a little more information, that's what I provided my course. And I really think it's a great thing that I might be able to reach more people because I struggled with skin picking all growing up. And this book that I wrote is the book that I wish the therapist would have had to help me. And so I really just want to help as many people as possible, at least with that first element of taking away the shame, building a little self-compassion and befriending your behavior at least a little bit enough to see what it's done to help you in your life. So that would be my goal for people to get at least that little taste of a different way to look at it.
Yeah. We are
Thank you
so
so
excited.
much.
I
Yeah.
know, I'm so excited. I also want to ask too, what is your book called? Where can people find it? And where can people find you?
Sure. So it's the easiest way to find me is just stacynakell.com, STACYNAKELL. And you can get in touch with me there. You can see my blog, and my book is on that site. But also the book can be found on Amazon and Routledge. It's now available in paperback, so it's more affordable than when it was hardback. And then I do have you can find me on a number of podcasts. On Therapist Uncensored. There's another podcast on Clearly Clinical. There's a, a podcast for therapists. So there are other ways to find me and my work. My book is called Treatment for Body Focused Repetitive Behaviors: An Integrative Psychodynamic Approach.
Perfect.
Beautiful. Well, thank you so much for the conversation today, Stacy. You're doing such an incredible work, and we're just so lucky to know you and to have had this conversation today. So, we'll be excited to see your course and check out all of your other resources. We appreciate you so much.
Much, and thank you all for holding this space.
Absolutely.
Thanks, Stacy.
Okay.